On behalf of Team Hitcon, I once again
Good
welcome you
afternoon.
all to the next session of Hitcon Hit Talk. As all of you are aware, Hit Talks are the series of talks from the experts in the field, in the field of medicine as well as in the field of technology, and it is happening once a month. And we try to come up with new speaker and new topic all the time, so which is very helpful to all of us in the clinical practice. So the ultimate idea is to keep the members updated about the latest in the innovations in the field of technology and make their practice and life better. Today, we are absolutely here with a new topic about remote consultation. We have discussed a lot of things about teleconsultation, telemedicine in the times of COVID, and COVID has changed the game like anything, and the acceptance has on the part of patients has increased like anything. So, I will not discuss much about it, but today we are fortunate to have a galaxy of speakers and a very learned chairperson from UK. As a speaker, we have got Dr. Raghavendra M.S. with us. Welcome, Dr. Raghavendran.
Thank you, sir. Good afternoon, everybody. Good afternoon, all the eminent leaders.
And we have got Dr. Sahadev
Good
Swain from
afternoon.
who has joined all the way from UK. Welcome, sir.
Namaskar.
And we have got two eminent presidents from the two eminent family physician bodies of India. Welcome, Dr. Pragnesha, who is President FFPI.
Thank you. Thank you. Yes, I welcome all of you. Namaskar.
And Dr. Mohan Kumendra, who is the President of Academy of Family Physicians of India. Welcome, Dr. Mohan.
Thank you. Namaste. Thank you.
I would request Dr. Pragnesh, would you like to share your thoughts in a minute about the current topic and current topic?
Thank you, Dr. Pragnes. Basically, in this era of AI and medical technology, the remote consultation is I think, the future of the medicine and in the family medicines in coming 10 years. Because now everybody wants, now the famous slogan given by the Reliance Group of Industries, "Kar lo duniya mutti mein," like that. So everybody wants that they all get their medical services at their room or the living room. So I think this is the very good concept that family practice for the remote people by any social media or any application or by any video consultation. It is a wonderful concept, I think.
Dr. Pragnesh, I would request Dr. Mohan would like to say something on this topic in upcoming mega show in Bangalore.
Thank you. Firstly, at the outset, I would like to thank you, Dr. Pragnesh, and Team Hitcon for inviting me and giving this opportunity to participate in this discussion. It's my pleasure, absolute pleasure here to be here today for this very, very important discussion on the remote consultations and use of technology. I'm particularly delighted to get connected again to two of my old friends, Dr. Raghavendra, who has been a long-term colleague from AFPI days in Bangalore. And of course, it's an absolute pleasure to see Dr. Sahadev Swain from UK, who has been a mentor of AFPI. So it's a great pleasure to be part of this discussion. The integration of technology in healthcare. Healthcare technology, I would say, in the day-to-day practice is no longer a choice. I think it's become inescapable reality, actually. So although the technology was part of healthcare even before COVID, but I think the game changer was the COVID-19 pandemic, which acted as an absolute powerful catalyst, I think, in fact, it forced people to adopt to telemedicine and digital health solutions. Worldwide, I can say, but definitely in India, it came up as a big catalyst, actually. So I myself, during COVID, has given thousands of consultations all across India and even from different countries. So while the benefits of remote consultations are definitely undeniable, but it's also equally crucial to address certain challenges associated with the teleconsultations, lack of physical examination, potential chances for misdiagnosis, and patient data security. These are the very pressing concerns by people who use technology and teleconsultation. And also legal and ethical aspects, especially when you're consulting, because the topic today is that teleconsultation across the world. So there are ethical and legal issues which are different in different countries. So navigating through these challenges and through these responsibilities and even the consent framework and all those things will be really interesting to listen from Dr. Raghavendra today. I am looking forward to Dr. Raghavendra's insights on these complexities, especially. And also, I would say that as we embrace technology, I think we must also remain mindful of its limitations and the responsibility as someone who is providing this teleconsultation. So I'm sure that today's discussion will help us learn and also help us know how to navigate through these challenges. Thank you once again for being giving me the
Thank you,
opportunity.
Dr. Mohan, for the message, and would like to invite everyone on behalf of Dr. Mohan to the all the family physicians of India to the Monka SARC event coming on 3rd, 4th, and 5th of April in Bangalore. So, on behalf of Dr. Mohan and team API, I invite you all of you to that. Let's jump on to the topic of today. As a chairperson, we have got today with us Dr. Sahadev Swain. Sir is the president of MRCGP UK, a family physician leader, a good author, and the seasoned speaker. Welcome, sir. We are lucky to have you today. Welcome, Dr. Sahadev, sir.
Hello.
Sir, you are muted. So, sir is going helping us today. And as a speaker, we have got Dr. Raghavendran. Dr. Raghavendran is a senior consultant family physician who is again a seasoned speaker, entrepreneur, and he's into doing into a lot of new things. एंड डॉक्टर राघवेंद्र अगर हम कुछ साल पहले की बात करें तो शायद आपको शादी के लिए लड़की नहीं मिलती, बोले लड़की के पास तो दवाखाना ही नहीं है, कमाता कहाँ से होगा. सो मैट्रिमोनी कुडंट बीन एन इशू के बोले यार लड़की के पास तो दवाखाना नहीं है, सेटल नहीं है लाइफ में, पेशेंट कहाँ से देखेगा. तो वेलकम डॉक्टर सहदेव सर.
Sadhu,
Sir,
I think,
would like you to share some welcome notes on the topic and then we can start the Sadev sir.
thank you. Thank you, everyone. Thank you for inviting me. Hello. Greetings from UK. I'm very pleased to be part of this important talk that we are going to discuss. The remote consultation has definitely changed the life of patients and of doctors as well. We have all adapted to this new life to a very great extent. Like Dr. Mohan said, it has got a lot of advantages. Of course, some disadvantages. The disadvantage being that we miss that touch, the human touch. But sometimes you have to exchange that for the advantages that we are getting. I'm looking at the potential of it in the worldwide. Not only we can be connected like we are connected now from different parts of India, India being a huge country, and different part of the world, we are talking as if we are sitting side by side. It's a great advantage. The same advantage I think we need to take to the rural areas. If I give you a story, recently I was in my village, which is in a corner of Odisha. There is a chap who was a plumber in Bangalore and now sits in the house, probably of my age. Actually, he was a year above in the school. Now paralyzed, had a stroke because of lack of taking medication. Sitting there, has a wife who has got diabetes and she is very weak herself. And nobody nearby to take his for physio. He was very happy to see me, but what followed is crying. All that came is tears of helplessness. I was helpless as well. he cannot travel anywhere nearer to Cuttack or Bhubaneswar so that I can help him for physio. Imagine I was trying to set up a physiotherapist remotely who can help him a little bit, of course, but that technology problem. So this is just to give an individual story that this technology has got potential to reach to the remote villages or to the hills of Rishikesh or anywhere in the world where it is needed most. And we can still create that continuity by being the family physician. Every family deserves a family physician, and we have to design that way, and technology will help us to do that. So with that, NHS is changing and changing further now. For example, we are now, our health minister has allocated some money. Instead of everybody phoning up 8 o'clock in the morning, throughout the day online, they can put the request and people will respond to it. So technology is going to change the world, and let us adopt it to the best of our ability and still maintaining that human touch when needed, and being the family physician, the trusted friend for our patients, particularly who need us most. So, with those few words, I would look forward to hearing from Raghavendra and further discussions of today. I'm very pleased to be part of this.
Thank you, sir. Thank you for your encouraging and kind words, and of course to bring the real case scenarios that we see in day-to-day life today. So, Dr. Raghavendran, let's jump on to the today's topic. See, I've designed some set of questions. We'll take that first, and after that, if at all any questions we get from the audience or Dr. Mohan or sir wanted to ask, then we can take that in advance. Uh, Dr. Raghavendran, first thing is, what prompted you to start this online consultation, exclusive online consultation? Everybody does online consultation, but along with a sit-in place. Matlab they've got a clinic or something or hospital to work and then do the online consultation. You close down your clinic and exclusively doing online consultation. What prompts you to that? Maybe high rental in Bangalore or something else.
Um, Thank you for giving me this opportunity, and I'm humble that in front of stars, sun, and moon, I am very humbled to present myself. It just happened. It is something like a joke. What I would say, there was in a zoo, there was a story like they said that anybody who can cross this crocodile park will get a benefit or something like a prize. Suddenly, one of the person suddenly fell into the, what do you call, the crocodile park. He crossed it and he went on the other side, and he was applauded like the way I'm applauded now, that you are the winner. He suddenly got back and he asked, who pushed me inside? So, so it is the same story. It is not like it is by choice. I did this, but it only happened. We all started from family medicine, and way back in 2010 or 11, when I was the head of the department of family medicine and health checkups for Apollo. That's when it started. That Bangalore, I started a lot of things. Like I had running hospitals. I had a chain of clinics. We were working with MedPlus, Religare. Then we had rural clinics and everything. Then I had a very psychological, or what you call the spiritual moment. I was just coming back from one of my rural clinic in Andhra Pradesh. So I used to go cover. I had a lot of clinics in border areas of Bangalore. So on the way back, suddenly I felt that very tired, like maybe bodily tired or emotionally tired. Like how long I'll keep running like this? Like I had a battery of clinics, everything, lot of staffs. Everybody is enjoying their life. Everybody is seeing movies. Everybody, but only I am running whole day. And sometimes Bangalore also over a period of time it became very congested, traffic started becoming, and very difficult to handle the staff, retail staff, real estate started going up. Then the profits, and I mean, any practice is like a business. It keeps on changing. So it kept on changing, and the overhead started going very high. It so happened in 2017 that I had invested in a lot of health startups. Then I was in the process of acquiring an hospital. So I asked my wife, see, this is a verge. where I'll be jumping in, and moment I'll take over this hospital, the life will be different. I will absolutely not be able to give you time for next 10 years. Like I'll have to totally concentrate. She took a U-turn and she said, no, I want a very peaceful life. I want a 9 to 6 life. Then I want, this is the way of life. At least once in a year, I want to go abroad. Every 3 months, one trip. I want you to be in Sundays with my child. This is what we want. So that is where we took a U-turn and we said, okay. Then we came out of everything. And luckily, we were absorbed in a very good medical institution, PS University, which is a tri-state, which is in just in the border of Bangalore. There we had a lot of chance, and that is where we got a lot of time and ideas. And all patients from 3 different states, and even from West Bengal, we had a lot of patients. But the problem was patients had to come from 200 to 300 kilometers. Like we were the only hospital which is very far, and things became worse during COVID. COVID, absolutely, there were shutdown, and even for basic things, it was very difficult. And like every organization will lack its own, every big organization to steer itself, it will take time. So that is where we started working on this. And initially, I was frightened. I will be the last person to talk to patient online because we are trained to touch the patient, speak the patient, examine the patient. And online, mind you, for patients kept on asking, I kept on avoiding. But it was very difficult. Then one patient died because of abnormal sugar levels. And patient called me and said, if you could have spoken, the patient would have been alive. So that's where I said, okay, let me start. And from there, things took off. Then over a period of time, in just I think 1 year back, things went very well financially. God had blessed us. So I went into my passion of now becoming a full-time health strategist, transformation consultant, and other thing. And I had to travel across India. Even now, I'm sitting in Gujarat, Rajkot, and speaking to you. So we are trying to transform one of a 70-year-old hospital from trust to corporate. So I had to travel. Like I kept on have to travel, but all your clinical skills are rooted in seeing patients. See, unless until you see patients, you cannot implement those technology or strategize your work. So that's where I had to take a very strict call that, okay, now I'll have to travel. So I will totally become online. Now I am able to travel across the world. So last 1 year, I've totally become online. At the same time, I'm able to travel across India all the way. That's how it happens.
So you ultimately proven the one thing right कि हर सफल पुरुष के पीछे एक स्त्री का हाथ होता है और जो कुछ भी रह गया था वो कोविड ने धक्का मार के करवा दिया.
Okay, sir.
That's true. Yeah, and you were told about a very important fact of life कि कहीं तो एक ब्रेक लगाना जरूरी है, बैठ के सोचना जरूरी है. Let's not get into this philosophical talk. Let's stick to the practical things. Now let's come to the part of technology. How do you do it? Is there any platform where patient books your appointment, then you confirm, you consult something? How actually the things are happening now?
Sir, way back in when I was doing my PUC, there was a saying that don't climb the ladder when too many people are there. You'll always fall or you'll be pushed. So the easiest way to get into the market is where no technology is there. So the easiest place is rural healthcare. See, in
Right.
rural healthcare, you see all the major startups, or because I'm already in health startups, and on the other side of the river, where I see where we are trying to acquire customers, we are trying to do so many things. The competition is too much. Per acquisition of a patient or customer, it's very huge. But in the rural health, it is still nascent, and the competition is absolutely maybe very, very less. So God bless me that we were able to keep a track of all our patients from past 25 years. From the
Okay.
day one, 2002, where I've been practicing, we have been having a data of all the patient, whomever I've seen in the rural background. And my work during the PS University also, where we were able to touch a lot of patients. So we started touching rural patients. Yes, we are using the open platforms, simple things like WhatsApp, Google Meet, and your GPay. These three things, and during COVID, it became very open. One interesting thing happened during COVID. You remember, all the children were given homeschooling. Every child from 10th, child to 10th standard, we were given homeschooling, and every child at home had a phone. So then we had a very good idea of tagging senior citizens with their children. I mean, grandchildren. Absolutely, children will not have time, but grandchildren and grandparents, they get tied up. So we started touching all the schools. So I did one experiment with one of the school where I was a trustee. So I spoke to all the children and I said each child will take care of their grandparents. So children will adapt the technology very fast. They can move their screen. They are much faster than any of us. So now tagging now they're able to take care of their parents, and through that they're able to do. Of course, what we do called as a time banking. See, any person, any doctor will have what is known as time banking. My work starts at 5 o'clock in the morning and goes on till 10, 11 in the night. So what we do is, unlike in the clinic where happens, whether you have a patient or not, you have to sit in the clinic. You have to go sit there. And sometime patient will come, sometime patient will cancel the appointment. We are not able to do anything. But the one good thing about online consultation is you can be anywhere. But only thing is you should make sure that surrounding environment is good and background should be plain. That is whether you should be able to talk. There are few places where we have tied up with a few agencies, few NGOs, few startups who use their own platforms, like they have their platform. But majority of the time, we are able to use this common platform, which is common across the world. WhatsApp and Meet, which is uniform, is that. Only thing is the payment gateway, it keeps changing based on the countries. This is how we are able to use it, sir.
Okay, so matlab, you mean to say that without having any fancy software or any very organized players tools, with the basic set of tools, as you said, the WhatsApp people are quite used to WhatsApp. Even senior citizens are quite so you can do the thing. So first, how do patient fix up the appointment? They drop you a message or you fix up some time slot or something. How do they send the message to you?
See, when you try to keep it a software kind of a thing, what happens? Patient directly logs into the software and books an appointment. Like
Right.
there are few slots, like maybe between 6 o'clock to 8 o'clock, or few companies where we have tied up with few companies where we have given a slot. That is okay. 6 to 8, I'm not going to take appointments from any other places. But other places where happens, patient sends a message or gives a call. When we say, okay, are you free at this particular time? And at particular time, we send a Google Meet link. We send them a link telling that this is what is a link. And at that point of time, it gets automatically, it starts depicting in your calendar, as well as you get a message. And through that Meet, when you're able to talk to them. When you're talking through Google Meet, at the same time, you can use your WhatsApp also. Like suppose somebody has to send a report or somebody has to send a talk, or suddenly in between, the patient wants to show some previous record. You can keep talking in the Meet, at the same time background you can keep talking in the WhatsApp thing. And after everything, you send him a PDF form of prescription, and then you get a Google payment gateway.
Right. So, and does there any staff or support team who helps you in organizing this sort of appointment? Otherwise, it will become too clustered to have messages from all and organize them and all.
Initially, we had a problem. Like suppose now I'm talking, suddenly there is a call. Suppose there is a, because the main link to Dr. Raghavendra is one single phone number.
Exactly.
Because one doctor, one number. You can't have 10 phones or you cannot clone yourself. So
Absolutely. Doesn't
the
work.
only way that is the main thing. We are trying to work on AI and other places where we are trying to clone your thing, but still it's still in the background work. Most of the time, what happens is we have a network of well-wishers. Like example, there is one elephant reserve in border of Tamil Nadu, where there is one very good friend of mine, is a forest reserve officer. There is absolutely no way that they can come out of the forest reserve and things like that. But he's very good in technology. So what happens? He takes up the responsibility of fixing the appointments and other things. There is one person who is in a very deep part of Tamil Nadu, where he's a pharmacist, but he takes care of around 20 villages. So a lot of people buy his medicines from his pharmacy. So previously he was a pharmacist. Now I have trained him in booking the appointments. So he takes care. So, in fact, you have to be very frugal. See, because patients cannot pay a very high amount of fees, you cannot increase your cost. You have to make sure that the costing is kept at a very affordable level, because they are very sensitive to the cost.
True.
100 rupees you raise, they will say, okay, I will take a bus charge of 10 rupees and I'll go to medical college. I mean, they're very, very sensitive in that way. So
True.
you have to make sure that you keep them comfortable at the same time make sense. So like this way we are able to. There are a lot of Janaushadhi centers. We tie up with a lot of Janaushadhi centers. They try to help us out. Then we have a chain of NGO of pharmacists. Like there's an NGO of pharmacists called as Chemist Brigade, which is in the southern part of Bangalore. There are around 42 pharmacists. They're there from almost 50 years. Many of the pharmacies are there from 50 years. Each pharmacist will cater to minimum of around 5,000 population. So many of them don't have doctors across. And now because of competition and other things, even they have to cater to their population. If they miss even one diabetic, they miss an entire 1 year business of
True.
medicines. So they try to fix it up medicine. So, but I do have some staff, around 10 staff we have across India who
Hmm.
keeps working for us. But majority of the time, we tie up with well-wishers or partners in that way.
Okay, understood. And most of the patients that you are attending as of now are from rural, or there are from patients from bigger cities also?
I would rather say like around, if in 100%, around 40% are from the rural. Another 30 to 35% are from the old age homes, gated communities, then traveling group of people. Then another 20 to 25% I will put it across to corporates. That's how we are able to manage.
Okay. Coming to you, Sadev sir, how is the acceptance of this remote consultation in UK, and is it a routine practice or not very practicing very routinely, sir?
Yeah, I think it's very much routine. And during COVID, it was almost 100%. The general practice doors were closed. It was almost all through remote consultation, except those ones who need to go to hospital were sent directly. But
Right.
those who need to be seen, they were seen in isolation rooms with PPE cover. But now after that, I think there's a lot of demand. We continued for like that for some time. But after that, there is demand, of course, for human touch. So is at this moment is almost 50-50. 50 is remote and 50% is from face-to-face consultation. So I think there is always demand on general practice, because almost everybody, except if you are having heart attack or something like that, or you have a broken limb, you can go directly to accident emergency. But everything else, at least during the working time, goes through the GP. So 90% of the consultations, transactions at the cost of about 9% of the NHS happens at the general practice level.
Okay.
So they are consulted, everything is consultation is done there. Only they go to hospital only for complicated cases. And that's how NHS is cost effective. What is being adopted now recently is called total trials. You don't have to pick up the phone. You just online put a few questions. What is the problem? It passed on. And then that is looked up by the dedicated doctor for the day. He looks at what is the capacity and who is the appropriate person who has seen this person before they get distributed. So depending on, then that person then talks to them and decides them if they need to be seen, then, or they have preference to be seen. Some people have, particularly elderly people, who like to see your doctors. They are brought in and they are seen. So remote consultation is almost part of life, and this is also happening now more and more in hospital setup, mental health setup. The preference, for example, recently I was in India. My pre-assessment was happening from UK in India.
Okay.
So, that's the kind of way of life now.
Yeah.
It has got disadvantages. Some people, they did not pick up the phone once or twice, then their appointment is gone and they have to rebook it, and which is taking longer time. I really like the concept of getting connected to NGOs. I think there's more scope. I'm sure you are doing that. You will hear more.
Yeah.
Using them for prevention work. For example, detection of diabetes. Diabetes goes undetected for about 10 years. So
True.
if you can detect them early, probably also comes to the blood pressure as well and other things. So hopefully there is scope for that prevention work as well. And in the cities also, for example, there are slums. So those people are also as much neglected. They are as the rural people. If anything, actually, there are certain programs in the rural areas through Sati and through ASA, all that. But I think the urban poor people are neglected the most because there is no organized system to take care
True.
of them in India. So there's scope for them as well. But I'm very pleased what I'm hearing from Raghavendra.
Great. So this is again, you suggested a new and proper way of using technology. So triaging patients as we do in ER, triaging patients before online consultation and maybe guiding them to respecting consult. This is quite interesting. Thank you, Dr. Sade, for your inputs. Dr. Raghavendran, coming back to you. See, as you have stated in the beginning that we are doctors, are clinicians. If we always would love to feel the pulse of the patient, and that gives a lot of confidence to the patient as well as the treating clinician both. Now that touch is missing here. And if I say I want to auscultate something, if I want to see particular signs or something, so how do you manage this? Are you using any sophisticated gadgets like smart stethoscope, this and that, the new hypnopla coming, or really how do you manage this?
Sir, one thing I want to say is consultations itself, as you know, it is different types. Like example, when you're reading health checkups, see, you just have to read out the reports most of the time. And
Yes.
many of the time, it is like a clarification. Patient has already got his diagnosis and he wants to get a clarification from you or a second opinion from you. Or there will be some time that patient has already seen some 3 to 4 doctors and is totally confused with all his medicines. He doesn't know, like each doctor would have written his own set of medicines and he wants somebody to summarize all this and give him in a summary. Or there will be sometime like recently we had this Prayagraj where a lot of my patients and all have been traveling across India from abroad going there. They all require travel medicine. So many of a time, what is the simplest, your only best friend where you can have is the nearest pharmacist. What I generally tell my patient is, you tell me your complaint, go to the nearest pharmacist because my a doctor language, as you know, as a joke or as a reality, our language is understood only by the pharmacist. So either my handwritten or my orally, whatever is telling. And
True.
any pharmacist across the world, when he's going to get his prescription honored, will always help you.
True.
And today, mind you that every pharmacist has his own glucometer, has his own BP machine, and many of the time he will also tell you the symptoms which the patient cannot tell you.
True.
And yes, there are few places like one place is in Krishnagiri. There is an NGO which attaches to all the drivers traveling across India. There is a toll gate. So there is an NGO which sits there and there's a boy who's sitting who, who uses the stethoscope and I mean digital stethoscope. And we have also trained him. Like when I say 1, 2, 3, 4, he knows one is mitral, tricuspid, aortic, and he doesn't require IRAS. But I'll tell him that 1, 2, 3, 4. He just have to tell me what is it. And many of the time he can even record. Yes, digital stethoscopes are very cheap. There are
True.
you can get it at 10 to 15,000. But only thing what we need is whether it's normal, abnormal. That's it. If you really want it. And most of the time, whether it is normal heart sound or it is a leaves, like the leaves, no crumbling, gurgur type. I think that much is enough for you to understand that the
True.
patient is abnormal. To confirm, yes, you'll have to get a CT, chest X-ray, echo, ultrasound, and everything. And few places like Tamil Nadu and other places where government itself is having its own platforms, like they're able to reach to the nearest patient or everything. So that can be done. There are few places where you don't require as such auscultation. Many of the time it is counseling, like patient requires diet counseling, patient requires how to use the medicines. There are a lot of things like that. So it happens, it is manageable. I think around 10 to 15% you will definitely require auscultations. where we either manage by the associated person who's sitting there,
Right.
or we try to get additional investigations through that, sir.
Okay. So as you rightly said, whenever there is a this remote consultation are more useful when patients want second opinion or opinion of rather than more intense clinical examination may not be required in particular patient. So I think it is not for a 1 or 2 day fever or something like where you want to like to see everything in detail and rather than before prescribing anything. Good practical points, and I'm also happy that you have trained persons to understand the and train them in a very basic way, where even obviously a non-paramedical person can also take care of that. That's a really wonderful thing that NGO working at the toll gate, and that's where the real this kind of consultations are required, because where there are no physical setup. So for rather than bigger cities, this is the places where things are required. So you examine the patient, and whenever required, you send the prescription across. And as you said, you are collecting payment via various payment methods that are available in the market. Now, coming to that point, how your patients are satisfied? Because what happens is, हमको तो पता है, हम 2 मिनट में देख भी लेते हैं कि इसको कुछ नहीं है, 15 पेज का रिपोर्ट है, maybe we finish up in seeing just 2 minutes. But patient has a lot of questions to ask. So how is the satisfaction level on part of patients?
Sir, this is a trade secret. You talk in the patient's language, patient is happy.
Right.
Like you talk in Gujarati, if you say "Bado barobar, majama," patient is very happy. Oh, ye hamara bandhu, like that. So you have to speak in the patient's language. So I have been traveling across India, so I know around 6 to 7 languages. So Hindi, Tamil, Telugu, Kannada, partly Marathi, Bengali. Then now, since 1 year I've been traveling in Gujarat, so even Gujarati I'm able to read, write, even speak a bit. So many of the things it happens. One good thing about everything is you should know from which place the patient is talking. Example, if I'm talking to a patient from Indore, you compliment him that Indore, the cleanest city of India. Last year, कल ही आपका paper में आया था. So for this, what I do is every day, Hindu paper helps me a lot. Every day I read around 14 editions of Hindu. I keep a note of what happens in different states. If I'm talking somebody in Rajkot, I say, "अरे क्या हुआ वो hospital में ऐसा कुछ problem हुआ था." So the patient will feel that I am in that location.
Yeah.
Now, if I'm talking in Vijayawada, if I'm talking that, oh, recently there was a function in Kanakdurgamma temple. What happened like that? They're happy. So you should be able to immediately connect and make sure that the patient they should feel the doctor is from my place.
True.
And definitely you can find some connect. If somebody is from Tamil Nadu, I'll tell them that I studied from Chennai. Then if somebody is from West Bengal, I'll talk about Ramakrishna Paramahamsa. If somebody is from Maharashtra, I'll talk him about recent Chava movie. So you just have to touch him with his own dialect, and everybody is connected to their own setup. And best part of technology is you can talk to them up to the point, and the rest can be delivered through in a print way. Like example, the diet, the patient expects everything to be told in the diet by us. But here in online, I'm able to send a diet chart. So if I have to tell him something, I can send him a video. If I have to send him some clipping, I can do that, which generally it is very difficult for us in consultation because everything has to be finished off at that point of time on the table.
True.
But here, I always have time. Patient will wait for my prescription at least for half an hour, which does not happen in direct consultation, where the entire transaction gets finished in that table itself.
True.
So there are few advantages, which becomes a benefit for us in talking, sir.
And I think after the finishing of the consultation, when we do it in person, patients are not receptive for further inputs whenever they are going back. Dr. Sadev, I think you would like to add something here. Sir, आप कुछ कह रहे थे?
नहीं, हम ये बोल रहे थे, I think it's a very good technique. I know the trade secret now. He sends me information about Odisha every now and then. I thought he's only interested in Odisha. Now I know he's interested in everybody. So that's a very good news for me.
So that's with the remote consultation practice gives him a lot of time to do all these things.
Not really. Remote consultation needs the same time, if not more. He's putting it easy. It's just like how he's putting it is making you feel easy.
True.
It's like Virat Kohli taking the catch. You go, You throw a ball and take catch, you will fall first before the ball falls.
True.
So experts make you think things appear easy. So what it just said is called small talk, and that is how you connect to the patients and develop that trust. So that is essential. It's
True.
not very different than my practice. They know, yes, the doctor is interested in me and in my story. So the second opinion, actually, I had thought of creating a secondopinion.com website, which I had, and I was talking before Corona with some technology guy how to create these hospitals without walls. And most of the work, everybody in India almost goes to three people to confirm the same thing. But if
True.
they know, I know the trusted Raghavendra, he will go in the first place there. Only it will end in there. So that trust is very important to for the patients,
True.
and that happens over a period of time when you create that continuity. So everything there, like my Gujarati patients will go and see the cardiologist in the hospital, will come back to me for reassurance and for translation and what to do next, to go for this operation or not for that operation. So that is the trust that we are working. And the family medicine is unique in that way that you create that trust. The family is trusting you. They come for your trust. And that is the one that cures them, reduces their anxiety, reduces hospital admission. In fact, it is proven to improve their mortality and morbidity in long term.
Yeah.
So I think that's wonderful what I'm hearing.
Agree. Dr. Raghavendran, we have talked about the various aspects and how the things you are doing. What are the common problems that you have faced? Maybe internet connectivity, maybe other patient not understanding technology, maybe adaptation of technology is poor. What sort of problems that you have faced, or commonly you are saying?
I think 5 to 10% of the time, the problem is no show. Like the patient has booked that appointment and it doesn't turn out. That time it makes you little feel bad because you are sitting and that time is gone. See, it
True.
is like a hospital bed. See, I'm on the other side, I'm an entrepreneur. For me, each second and each bed costs me. So I have a value for each second and each bed. So when that 10 minutes or 20 minutes is gone, that 20 minutes is gone. That means it is like zero. So it is absolute loss. So that is one thing which really troubles and sometimes demotivates you. Sometimes that, अरे नहीं आना था तो क्यों book करना था? You
Hmm.
start feeling like that. But over a period of time, you get you know how to fill that slot also, like how
True.
to fill it up. That is one thing. And sometimes the patient becomes very demanding. Like I had one patient where there was a case of a CA rectum, and it's as if like the patient wants everything to be done online. Like आप ही कर दो, डर्मेट भी आप भी देख दो, सर्जरी भी आप ही कर लो. I mean, everything they want it to be online. See, there are few places where the consultations are totally free. I mean, the
True.
company pays for them and everything is free. They don't even want to take a second opinion. आप ही देख लो sir, आप ही बोल दो, आप ही कर दो. I mean, that thing, sometimes some patients are very demanding. And third thing is, you should be very careful that even your consultations are being recorded nowadays. Like
True.
the patient wants to recheck and re-go your consultation, and they record your consultations. So you have to be very careful. You have to be friendly at the same time. You should be very careful in what you're talking. And fourth thing is, there are few countries where you have to be very careful in prescribing medicines. Like if
True.
you're going in GCC countries, you should be very careful in prescribing anti-epileptics or things like tramadol and things like that. I had one patient who was going to US. She didn't tell me that she was going through Qatar. She got down in Qatar, and in Qatar her baggage got held up because she was carrying tramadol.
Hmm.
So there are few drugs. So you have to be very careful in prescribing drugs. And when I'm talking to a patient, I'll ask them. You should even guide them that you keep all your drugs in your baggage. Don't carry in your carry bag. I mean, you should know how your medicine. This doesn't happen in regular consultations. So you should be very careful how the medicine delivery occurs. Then one more thing is you write look-alike, same-alike drugs. You
True.
tell something and they buy something. So there is no way that you're able to check the medicines. So now it has become very legally that you write the brand of the drug as well as the content of the drug. So I have a lot of templates, so many templates. So whenever I'm writing, to cut short the time, you have to cut and paste and you should be very fast. Like in 20 minutes, you should be able to talk, impress, review, paste, follow up, and make sure that the 20 minutes, it's like an act. It has to be finished like a drama. It has to finish. So these are a few challenges. And sometimes, very, very rarely, they don't pay you. They take it for granted. And so I keep telling them, either you give me 100% blessings or 100% fees. We say your fees is 400, they'll pay you 100. So I send back the 100, I say I want full blessings or full fees. So these are few, I mean, not just as a joke, these are few
Okay.
problems which you face.
Okay, but with the advent of this lot of good EMRs in the country, this lookalike and same drug shouldn't be a problem. Yes, the country-wise specification one needs to be aware of when you are prescribing and to a patient who is traveling or maybe already there in the outside the India. Good. And what are the legal issues that one needs to be taking care while doing an online consultation? What are the guidelines say in India? And we'll come to you later, Dr. Sardev, about something there in UK. Dr. Raghavendra, first you, please.
Sir, the legal issues is, see, in general consultation, there is no recording of what you're talking. In legal, I mean, in telemedicine or in the digital consultation, everything you talk, even your breath is recorded. So you should be alert. You cannot be very casual in consultation. Like I know a few people, they have gone to mall, they somewhere go to the nearest place and they do. That you should never do. You should, it is like a tapasya. If you're doing
Right.
consultation, you properly sit and you have to make sure yourself that 100% every word you're speaking, you need to be very alert because the other person on the other side is recording your voice. And that can be used against you in anywhere at any point of time. And now with digital things can be changed. Second thing, whatever you talk, that has to be written in the prescription. So
Right.
make sure that you remember what you're talking. So suppose I'm talking, suppose I'm telling that you have a depression, you need psychologist opinion, that has to be in the prescription. So you have to be very alert of, there should be no conflict between what you talk and what you write.
Right.
And the third thing is, you should know what not to do. Like example, you are suspecting medical myocardial infarction, outright you should smoothly tell the patient to go to cardiologist. Don't prescribe anything. Sometimes the patient has a road traffic accident and patient comes online. So you get into MLC. So by looking at the wounds and looking at the history, you should be very careful that this is a medical legal case. So you should not get into that. I have places where women have been ambushed. There is a domestic violence and they want to file a case against husband. They come online, they try to pamper you and try to take some consultation. You should be very, very careful. You should not consider everybody to be innocent. It's like there is always traps around. So you should be very careful in that thing. And you should make a clear record of what you're doing. Like every patient, as I told you, from the day one till date, every patient, even if I've done a free consultation, I make a note of those consultation and I'll keep it as a record at what time, what place, what consultation, which city, how much time I have given them, everything is recorded. So you have to be very careful meticulously in your records. And whenever you're giving teleconsultation, you should mention it that it is a teleconsultation.
True.
So, and time and another thing, I am a part of Indian Telemedicine Society. They keep training us about the guidelines and other things. And
Okay.
of course, you need to have a very good lawyer. So I have a very good lawyer who have kept him at a very good terms. So you should also keep him in your good terms. And places where you're doing lot of consultation, like suppose there are a few companies, a few NGOs where per month it goes more than 300 or 400 consultations. You can also have a medical indemnity,
True.
like you keep it and you mention that these people you are doing online consulting. That's available.
Any checklist or something is available that you can't prescribe this thing online or something like that, or ये first consultation में इसको लिख सकते हैं, follow up में इसको, is there any guideline of this telemedicine society or something?
Schedule H, Schedule X drugs, you should be very careful. Anti-cancer drugs, psychiatry drugs, these drugs you should be very careful. And always prescribe the drugs up till the time. And when you're telling SOS drugs, you have to mention the number also. Like number of drugs, like 10 tablets, 5 tablets, like those things you should be very careful. And when you're talking and when you're giving second opinion, never mistalk about other doctors.
True.
You don't know like from where they're talking, what they're talking. You should always treat your other doctor as a friend. And
True.
even if he has done a mistake, don't openly talk in the telemedicine platform. Tell
Yeah.
that उन्होंने उनका मतलब से बोल दिया है, हम अपने मतलब से बोल रहे हैं, ऐसा. You should never try to downplay anybody and make sure
True.
that you
Makes
don't
sense.
do that. So these are the few things which you have to keep in telemedicine.
Sir. Okay. Sadev sir, how is the legal Inga there in UK, sir?
I think those principles hold good everywhere. I think he had touched upon very good principles. Something to add to that is maintaining record. So continuity for that record, whatever is not in the record hasn't happened. So
Right.
when you are challenged in the court, if I haven't recorded this person's temperature or what was the oxygen saturation or what did I say to this patient, how did they understood that, then judge is not going to hear to you. So maintaining record is important.
Hmm.
Should be contemporaneous and clearer to everybody. That also helps for the continuity of care because you are not there all the time. We work in the teams. So people only can make out what you are thinking from your record. So record keeping is very important. Yes, it's nice to have small talk and also, but at the same time, you have to maintain your professionalism. It has to, whatever you are doing or saying is must be professional. That includes your body language, how you look, and all sort of things. So those are important and stick to the principles. Like if you are doing intimate examination, always have a chaperone by the side. Sometimes they may say, no, doctor, it's not needed. You have to politely say them. So look, it's important for the third person to be there. Sometimes they don't know, it doesn't matter, doctor, you can get on with it. So don't fall into that trap. And most importantly, work within your competence. So I know I am a general practitioner, so I'm supposed to know everything as something about everything, but not everything about everything. And I cannot do everything. Like you have to know your limitations, whether it is a medication or a procedure. So those are most important things. When things have gone wrong, or some things like I've got experience of humor. Humor or touch. They are very personal. So in the humor, you may joke, but every joke will not be taken that way. For example, I will
True.
give you an example. A young girl, she had multiple unexplained symptoms. So what in simple terms you call hypochondriac. They always need third opinion. They are seeing if I said, Miss L, if I charged you £10 for every visit, I would be very rich. So she didn't take that. She put a complaint letter against me after that. So humor has to be contextual. And so is the touch. Touch is a nice thing, but not everybody wants to be touched.
True.
If you are seeing somebody, you can offer the touch, but it's up to them whether they take that. Other than that, if you touch them inappropriately, then you are in trouble. So those are some of the things. Basically, yes, be friendly but professional. Maintain your records, and so those are some of the things that will put in the context of medical legal cases.
Okay. Dr. Raghavendra, there is a question for you that what is the time duration that ideal remote consultation should last? Is there any formula or decide on case-to-case basis? Or you kept some fixed time?
Generally, it is around 20 minutes. But sometime when you take like psychological counseling, or when there is a surgery that has to be talked about, or when there is a family counseling, or when there is things like unification of reports. So in that time, we have to customize. Sometimes it can go up till half an hour also. But anything between 20 minutes to half an hour should be a very ideal place to functions.
Okay. And what would be your message to the doctors? See, we have got a lot of retired doctors who are not practicing at a physical location, but their knowledge is sharp, their physical abilities are good, and especially for a country like India, who needs more family physicians. What would be your advice to them that how they can jump onto this journey, because they all are experienced, they know how to talk to the patient, they have got clinical knowledge and all. But I don't know, there is some inertia in their mind which prevents them from starting remote consultation. How would you encourage them to do that?
So primary care is a requirement, sir. One single person or one single organization or one single government cannot handle. It's a uniformed effort of all of us. First thing I will tell them is join FFPI or AFPI. You'll be taken care of because you'll develop a friends for life. You can always fall back, and there is any person, because I've seen that it is like a family. As the name says, it's a family.
True.
First thing, they take care of you and they will guide you. And there will be a lot of training programs and there will be enough people around who will guide you. Second thing is, what I've seen is in places like where I've worked in remote medical colleges, the work gets over at 4 o'clock. And after 4 till next day, there is absolutely the time is vacant. You have so many, minimum of around 100 to 150 super specialists who are totally, their time is gone. Neither they can go out and practice or neither they can go to the nearest place. Maximum once a week they can go. That entire cluster of time, what we call as human hours, is all lost. So I think they should, even the government or the institutions, they should also start tying up with players like us, FFPI and AFPI, and start encouraging those doctors to render online services. So I think when institutions gain up, that can be done. And one more thing is people working in paraclinical and paramedical things like anatomy, physio, biochem, pharmacology. Those people are all, they have done MBBS, but they are not using those part of the primary care. I think once they start working with FFPI and AFPI, their clinical skills will start upgrading, and slowly they can also start doing consultations. And definitely, once you start enjoying teleconsultations, you need not have to work about because believe it or not, today to run one single clinic, a 10 by 10 clinic in a metro city will cost you nothing less than 1 lakh per month.
True.
And anybody would be a little frightened to invest 1 lakh per month at that point, and they don't know how long they will run it out. So for those kind of things, you can start in your own community. You start in your own apartment complex. You can start in your own rural sector. And everybody has phones and everybody is connected. There is a saying in one of our network organization, even the president of any country can be reached with 6 correct phone calls. If you have 6 correct people, they can connect you directly to those persons. So everybody is connected, and word of mouth is the best thing. You need not have to worry about paying huge money to all these platforms where they start bullying you or taking over your practice. Nothing like that. Straight. If you have trust with the patients, use the commonest platforms. And when the business goes on or the practice improves, then you start getting the platforms and start paying for your websites and other things. Because to afford those kind of websites, the load on money is also required.
True.
So you first start very small, then make it big. That's what I would write.
Yeah, there are 2 questions for you. We quickly wrap them up because we almost 1 hour since we have started. There are 2 last questions. One is for tramadol, as you pointed out, tramadol. Now, if prescription is given by the doctor, medication can be carried in the cabin bag or it has to be put in the check-in baggage?
Some countries will not allow either of them, sir. So you have to be very careful. So if you get to know that things like people are going to Europe or places like America, liquid drugs are not allowed. So you should be very clear and tell the patient. You will know if the patient is asking for a bulk prescription, you should always ask, are you traveling somewhere? And try avoiding those kind of drugs outsmart. But sometimes patients will insist, then you should be very careful. And guidelines are available. Each country travel guidelines are available online. So they will help you out in that kind of things.
Okay. Second question is, in countries like USA and UK, wherever prescriptions are not honored, can we give our patients some basic kit when they travel and they can consult us from there and we can say, you can take this?
Yeah, see, coming December, you will find all parents going there to deliver their children. Coming July, all in-laws will go there to enjoy the summer. So this is a very common travel. People travel from India to US, Australia, and other places. So when somebody is traveling, I tell them to carry a BP machine, thermometer, then the pulse oximeter, then things like even basic, there are kits where you can even check your ECGs. There are digital gadgets available, and we train the patient how to use them. And there are some companies which will even rent it out to you. Like you can take it for 6 months and you can get it back.
Okay.
When you're giving a travel medicine, you know that one common format you have to keep. So this is the common format, and whoever goes ahead, you know this is the format you have given. So
Right.
many patients will not know the drug name. So you know drug number 6, drug number 7, drug number 8, because that is a format which you are universally using it for anybody. And
Right.
anything above 20, like 21, 22, 23 is an additional drug. But 1 to 20 is standard for everybody. So based on that, you can always prescribe. And very difficult in US, even for one, maybe sometime even for one diarrhea patient has to wait. And I know people spending lakhs for even one basic diarrhea,
True.
gastroenteritis.
True.
And
True.
it's very difficult, and many of the children will not take the parents only to the hospital because of getting troubled. So this helps most of the times.
Fine. So thank you, Dr. Raghavendran, and thank you, Dr. Sardev, for joining us today for a very elaborative and nice practical discussion on remote consultation. And I think we have taken care of all the aspects. Technology is really doing wonders here. And as your Dr. Raghavendran has rightly pointed, no fancy gadgets are required. We can do remote consultation with basic things and then scale on to the this fancy EMRs and everything. So everything is possible. So thank you, Dr. Raghavendran, and thank you, Dr. Sardev, for joining us, and thank you, the audience, for joining us today. Thank you. Thank you all.
Thank you,
Bye-bye.
Pragnesh. I will leave. I've learned quite a lot. Thank you for giving me this chance to be part of this endeavor. But I have a question. You don't have to answer. This is a question for everybody. All this wonderful work that is going on, how do we incorporate into Pradhan Mantri's health, whatever endeavor is that? It's not the hospital. It before you reach hospital, you need all this. How do we need pressure, boat pressure, whatever it is, to incorporate all this into the health system so that is universal healthcare is available before reaching hospital. If we did that, the wards are now clogged with stroke patients. Much less patients will turn up there. We need to do more, spend that money for taking care of ongoing care rather than only in the hospital. So we
True.
need pressure for there. Thank you.
Thank you, sir. Thank you.
Thank you,
Bye
sir.
all.
Thank you so much.
Thank
Thank
you,
you for
everyone, for joining us today. Keep us connected for the more and more interesting talks in future. Thank you, everyone.
thank you.
Bye-bye.
Thank you so much.